Right, welcome to everybody. My name is Sarah Hess. I'm sure I've met many of you before virtually, so it's a pleasure again to see you. Thank you for joining this EPI-WIN webinar today. I will introduce Dr. Sylvie Briand, although she probably does not need much introduction because she's been on several of our webinars before. And just needless to say that Sylvie has a huge wealth of knowledge and experience across different health emergencies and WHO. And so to have her on with us today on this retrospective look at the pandemic, we're very pleased and privileged to have you, Sylvie. A few housekeeping things. Please do enter your questions into the Q&A. We'll try and have some time for that towards the end of the webinar. Otherwise, continue to introduce yourselves to each other in the chat. It's always so much fun for us to see where people are coming from across the world. And again, we are streaming this to YouTube, so the recording will be available on YouTube post-event, and we will also be able to share the slides with you after the event. So, and just one other thing, I just want to indicate again that we have interpretation from English to French, so if you're joining on Zoom, you should be able to find that and if you prefer to listen in French to this webinar. So Sylvie, over to you. I will share the screen. I've got the slides, but the floor is now yours.
Okay, thank you very much, Sarah, and thank you to everyone who is online. I'm very happy to be with you this afternoon and to share this perspective with you. We have been in this pandemic now for more than 1 year, and it has been a very hard work. But also it's very nice sometimes just to look back and see all what has happened. It has been a fascinating journey on some aspects. It has been also sometimes very sad when we have seen so many people dying and so many societies affected by this pandemic. And so I will try not to be too sad, and I will try to just highlight few challenges but also opportunities we have seen with this crisis, and ride this journey with you all for around 30 minutes probably. So next please. So today, or at least a few days ago, we were already above 113 million cases and 2.5 million deaths around the world, with a very different situation in different continents. Next, please. And as you see here, you have the most affected countries per 100,000 population in the last 7 days. So some countries are dark red, other are yellow. But if you take the map of a few months ago, it was different. So it's changing very quickly. Every 2 or 3 weeks, we have a new picture of the world. And that's why it's important to look at our dashboard, which is updated regularly to know what is going on currently. Next, please. And it's the same with the death. The deaths are also variable. The number of deaths per 100,000 population is variable. It depends, of course, of the number of cases, because we know that around 20% of the cases will be severe cases, and 5% of them will, of all cases, will die. So the number of cases drive also the number of deaths, but sometimes it's not completely linked, and we have seen places where in spite of a high number of cases, they have had very few deaths, and vice versa. So, but what is clear is that the number of deaths usually follows the number of cases by 2 weeks. So when you reach a peak, usually the peak in death is delayed, and this gives also a country's time also to get prepared. Next, please. So we have arbitrarily defined 5 stages for this pandemic, and I will go through them. It's a continuum, actually. It's a whole event, and it's very hard to define different periods, but we try just to have those stages to give you for each of them the challenges and the opportunities we have seen throughout this pandemic. Next, please. So when it started, really the question was, what is this new disease? Because the first cases were reported from Wuhan, as you may remember. It was a cluster of unusual death with no etiology. And so at the beginning, we didn't know really what was happening. And the other thing we didn't know is how this virus was transmitted. Very rapidly, we knew that it was from animal origin, but we had previous experience with this kind of animal viruses, like MERS, for instance, in the Middle East. And we have, for zoonotic diseases, either you have a spillover to human, but it stopped there, and you have a cluster of cases, but it never goes to a sustained community transmission. And so this was really the big question at the beginning. Will we have sustained human-to-human transmission with this virus? And so when it was declared a public health emergency of international concern on the 30th of January 2020, we had we thought it could be indeed a virus with sustained community transmission. But at that time, really, the global picture was not so frightening as we have seen after that, because there was, of course, exportation in other countries, but there was no death from this disease outside China at that time. Next, please. But things unraveled very quickly. From the December 2019, where the cluster of pneumonia was detected in Wuhan, very quickly, the next month, we have the IHR, International Health Regulation Emergency Committee meeting. On the 30th January, it was declared a public health emergency of international concern. By 11th of January, we had a clue about the virus. It was a coronavirus, and it was absolutely amazing, because on 11th January, we had already the genetic sequence data for this virus, which was unprecedented. And also, what was unprecedented is on the 23rd January, there was a lockdown in Wuhan, and all transport in and out of Wuhan were suspended. And it was really the first time we had seen this for many decades. On the 11th of March, the disease had spread in many countries in the world, and WHO describes the situation as a pandemic. Next, please. What started very early on as well, and this is really was amazing, is the research for countermeasures, diagnostic, vaccines, and therapeutics, but also research on the origin of the virus, on social science research as well, to try to understand what was this disease and how it affected communities and societies. And this first meeting of researchers in 11 and 12 February 2020 brought together more than 400 scientists. Some of them came to Geneva, but many of them started to join remotely through video conferencing, Zoom calls, and so on. And it was also very new for the international community to use those modern tools for communication to handle scientific meetings. Next, please. The stage 2 is really when we see this pandemic unfolding. And at that time, we had already few thousands of cases, 124, and also deaths, 4,000 deaths. And 118 countries were already reporting cases. Next, please. And this stage was marked by big outbreaks in certain countries, in Korea, in Iran, and in Italy. And we discovered through the investigation of those outbreaks in different places in the world that really mass gathering were really playing a key role in the spread of the disease. Because there was a religious gathering in Korea, in Daegu, but also in Qom, in Iran, and in Italy. Probably it's Champions League football match in Bergamo that started the amplification of the transmission in this country. And what we saw as well is that the case fatality ratio was very high in certain countries, especially in elderly population. And so we had the confirmation that this disease was quite severe in elderly population. And that's why after a few of these outbreaks, when we saw that the transmission was continuing to increase, we declared the pandemic because initially we thought maybe we could stop this transmission as it was done in SARS in 2003 for SARS at that time, but we discovered that this virus was quite different and it was nearly impossible to stop its spread. At least in March, it was not seen as an option. Next, please. But the picture was very diverse. We had still at that time countries with no cases at all. We had also countries with sporadic cases, some countries with clusters of cases, few clusters of cases, and then countries starting to have a sustained community transmission. And what we discovered is that it was possible to eliminate the virus if you stop transmission and prevent spread at the very early stage of the spread, at least until the cluster of cases. But when you had reached community transmission, then it was very complex to stop the spread of the disease and to eliminate the virus from the population. Next, please. And so for the countries reaching the stage of community transmission, they really had to slow down the transmission to protect, in particular, the health system. Because again, when this is a problem with epidemic in general, it's not the same to have one patient per day arriving at the emergency ward and having 100% at the same day arriving at the same hospital, because for the health system, it's very hard to cope when you have such an rapid increase in the amount of patients you have to deal with. And so it was very important to flatten the curve, reduce the number of patients per day, and also break the chain of transmission as much as possible by testing, isolating positive cases, and doing contact tracing so that you can reduce the transmission. And some countries really managed to stop the transmission with those control measures, but in other countries, they had to put in place more strict control measure and public health and social measures such as suspending school, measure at workplace, closing bars, restaurants, as well as close the border and ask people to stay at home in some places even. Next, please. So what are those public health and social measures? We have plenty, and these measures are not specific to COVID-19. They have been used for other epidemics in the past. These are measures that are first looking at personal protective measure to protect the individual, but also limit the transmission to close contact with hand hygiene, respiratory etiquette, and face masks. We have also social distancing measures that reduce the transmission within the community. And we have the contact tracing, isolation of 6 individuals, quarantine of exposed individuals, school closure or school measures. We have also measures at workplace, and sometimes you have to close business and also avoid crowding and reduce mass gathering. You have also travel-related measure. It starts with travel advices, but also travel restriction, border closure, exit and entry screening. And finally, some environmental measure to reduce the transmission through fomites, surface and object cleaning, and increase ventilation, which work especially for respiratory pathogen. Next, please. So those measures are really a toolbox, and each country have taken some of them or all of them. It depends on the type of transmission they were facing. But in most of the countries, they had really difficulties to cope with an increased transmission, especially when the transmission started with a big mass gathering, with a sudden amplification of transmission. And in those countries, health systems were under huge pressure, even in wealthy countries where usually they have a very good system able to cope with this kind of increased demand. And so many countries face, for instance, a constraint with materials, which were in short supply, lack of personal protective equipment, lack of masks, lack of oxygen and ventilators, and lack of COVID-19 diagnostic tests. Many health workers who were at the front line were affected. And we counted in October 2020, around 14% of the total cases in the world were in healthcare workers. And in some countries, many healthcare workers died at the beginning of the pandemic, either because they didn't have personal protective equipment or because they didn't really know how the virus was transmitted. And so they were the first one to die from the disease. But the impact also on health system was doubled. Not only there were a lot of COVID patients, but also usual healthcare was cancelled. And so many people also faced complication of chronic disease, for instance, because of the absence of care for them for their other diseases. So this is one of the indirect effect of the COVID-19 pandemic. Next, please. As the stage 3, the pandemic accelerates. This is a time where we see that the virus spreading to many continents and large countries start to be affected. So in July 2020, we had more than 10 million cases and over 503,000 deaths in 215 countries. So really a global phenomenon. Next, please. But beyond this health situation, what was really really new, I would say, is the fact that beyond the health crisis, there was an impact on the whole of societies. First, because of the national restriction, which had an impact on businesses and many individuals lost jobs. But also that there was restriction on travel, and then the tourism industry, but also the air traffic was really affected by those international movement restrictions. And so after a few weeks of lockdown or partial lockdowns, many countries wanted to reopen their society. But the question was how to reopen safely. How can we allow people to resume normal life without facing again an increase in transmission, and again facing this problem in healthcare facilities where sometimes they had to choose between patients because they couldn't take care of all the patients coming in the hospital. So after a few weeks of very strong public health and social measures, certain countries started to reopen their society, and it was the post-first wave, and we have seen the reopening of borders, and in particular during holidays in the Northern Hemisphere, and people really wanted to go back to normal life. Next, please. During this phase as well, it was very strange because some countries and continents seemed to be spared by the pandemic. And in particular in Africa, where the cases number were very low, and the mortality also was very low, and especially compared to European countries. So everybody was asking why is it so? Because at the beginning we thought, okay, usually Africa is affected by epidemics, so and usually they are really suffering from those epidemics like Ebola, cholera, yellow fever, meningitis, and other diseases. But surprisingly, with COVID-19, their cases were low and the mortality as well. So we still have not completely understood what was happening at that time. Many hypotheses were put on the table. For example, the low testing capacity, the underreporting, the fact that they have younger populations, so less high-risk individuals, pre-existing cross-immunity, or maybe the use of local treatment. So all those hypotheses are still being investigated, and the pandemic is not over. So we hope just that the situation will remain the same in those countries that are so far not so affected by the pandemic. Next, please. As the disease was spreading, we started to know a lot more about how it spread and how we can prevent also the spread and the amplification. We discovered that there was certain activities that was really involved in the increased transmission, such as singing, exercising, shouting, and so these are creating more risk for the exhaling the virus. But also we realized that there were certain situations or places that were more at risk, like crowded places, close contact settings, and confined and enclosed spaces with poor ventilation. But of course, your risk is not the same depending if you stay long in those places, and also depending on the type of activity you have in those closed spaces. So this is why during this stage of the pandemic, we really encourage everyone to be its own risk manager, to understand really well how the disease is transmitted, so that everyone can really adopt the right personal protective measure to protect themselves, but also to protect their close relatives. Next, please. The stage 4 was characterized by a multifaceted pandemic. As I said at the beginning, there was different transmission patterns in different countries. Certain countries remained with no case or very few cases, while others were facing a sustained community transmission with a plateau of many weeks of transmission. And so, but because big countries were affected at that time, we had a very high number of cases, and we reached few millions of cases, 46 million at least in November, and more than 1.19 million deaths at the beginning of the autumn in the Northern Hemisphere. Next, please. But at the same time, the research was really making a lot of progress, and we started to see a very promising results, especially in the vaccine development, but also therapeutics development and diagnostics. And so at that time, there was a partnership created. At least the partnership was created in April, June, during the first wave in Northern Hemisphere countries, but really during the summer and early autumn, this partnership really became very strong. And this global partnership was called ACT, Accelerator, Access to COVID-19 Tool Accelerator, which is an end-to-end process, starting with the research and ending with the distribution, production and distribution to COVID-19 vaccine therapeutics and diagnostics. And at that time, really, there were so many vaccines in development, 154 in preclinical evaluation, 44 in clinical evaluation, and 10 in phase 3 clinical trials. Also at that time, we had dexamethasone that was identified as a good treatment for severe cases in hospitals. And also an antigen-based rapid diagnostic test was discovered, allowing for more mass testing and more rapid testing also in countries who were needed testing to resume their activities. Next, please. But with this development of medical countermeasure, it was clear as well that it will be very hard, especially at the beginning, to ensure equitable distribution. Because, of course, even we have seen this now with the vaccine, the production started, but it was with a minimal number of doses. So definitively not enough to serve all the countries in the world. And so this is why we started to have discussions with different partners and to see how we can ensure an equitable and fair allocation of those products, especially when they are scarce. And so we issued the framework for equitable and fair allocation of ACT Accelerator products very early on, and we have been working since then on developing mechanisms to ensure this equitable allocation. Next, please. Another phenomenon that has been very special during this pandemic is infodemic. Infodemic is a tsunami of information, some accurate, some not, that spread alongside an epidemic or pandemic. And during this pandemic, managing the infodemic has become more challenging because we have seen the spread of mis and disinformation, especially through social media. And this is a very special phenomenon because nowadays nearly everybody, or at least more than half of the population of the planet, lives in two worlds, the physical world and the virtual world. And in the virtual world, the mis and disinformation are spread very, very fast, amplifying to an extent that has never been seen before. So the problem of this phenomenon is that it has generated mistrust in governments, in public health authorities, and in science, and thus hampering the good implementation of countermeasures in many countries in the world. So managing the infodemic is really critical because it's as critical as implementing vaccination or treatment, and it's really a fundamental element to manage the pandemic. So if you want to know more about all the activities that have been done with a consortium of partners, but also with many countries, you can access our website. Next, please. So the stage 5 is the stage we are now, first with a lot of cases in the world, as I mentioned earlier in this presentation, but the good news is that now we have medical countermeasures. And so the vaccine are being rolled out. We have done a lot of progress on treatment, even if we don't have yet really a specific treatment for COVID-19. The clinical management has improved a lot. We know a lot more about the disease, so we can really treat better patients. We know a lot more also about how the disease spreads, and we are able to fine-tune the public health and social measures so that it has less impact on societies. But we have now many millions of cases, and we have reached more than 2 million deaths. Next, please. So many vaccines are still in the pipeline, even if now some of them are used. The research continue, and many research groups are developing new products for the vaccine. So the story is not ending now. I mean, it's still continuing. Most of them are injectable and with 2-dose schedule, but we are starting to see vaccines with 1-dose schedule and probably easier to use in the future as well. So this is really bringing a lot of hope, I think, and a lot of happiness, I think, in many places of the world. Next, please. But so far, I mean, even if now more than 265 million vaccine doses have been administered from different vaccine platforms, it's not evenly distributed. Some countries have been able to vaccinate nearly half of their population. Others are just starting with a few doses, and some countries have not even started yet. So we are still in this phase where we try to accelerate the allocation of vaccines, and I hope that in the coming months we will have a better distribution and a more equitable allocation of those products. Next, please. What is important is to understand that for vaccine we have very different products with very different profile. The vaccine platform are different as well. In Europe and United States, they are using a new type of vaccine, RNA-based vaccines, while in other parts of the world, they are using vaccine built on more classical platform, I would say, like based, for example, like Sinovac on inactivated viruses. WHO is working to provide the emergency use listing to most of the vaccines that are already in use, so that they can be accessed by many developing countries that are waiting for the WHO authorization to really buy them. So everybody's working very hard to make sure that those vaccines can be available everywhere on Earth. But you see, there are many more in the pipeline, and the distribution of those vaccines is very variable in different continents. Next, please. And unfortunately, we also realize that even if there is a lot of hope with these new medical countermeasures, the virus is changing. And we have seen the variants. So the fact that we see variants is not unexpected. I mean, every virus evolves. So we knew that we would see this kind of emerging variant at some point in time. But the fact that now we have vaccine, we need to be even more cautious about those variants, because some of them may undermine the efficacy of certain vaccines. So that's why we are monitoring them. But so far, most of the variants that have emerged and are of concern, because probably they generate more transmission. So far, the vaccine are still efficacious on those variants. So there is no need yet to really fundamentally change the strategy of response. But we really need to monitor those variants to make sure that the situation is not changing to a point that we will need to change the vaccine composition, or to really change completely our strategy to prevent and control COVID-19. Next, please. So one last point, I think, which is very important, is because of those impact on societies and economies, we have seen that a significant impact on the global economy, and vulnerable people before the crisis became even more vulnerable during this health crisis. And we have seen that more than 4% contraction in GDPs in 2020. That 88 to 115 million people are now living in poverty due to this crisis, extreme poverty, and 9% of the global working hours were lost in 2020, which is the equivalent of 225 million full-time jobs. So I think now we are really to deal with two crises, the health crisis, but also a more profound crisis, putting at stake the stability of many societies and economies. Next, please. And because we all live in the same world, and as I said before, I mean, no one is safe until everyone is safe. I think it's a bit the same for the economy. And so we need really to understand that all these extreme poverty will also affect everybody, not only the ones that are safe, I would say, but really everybody will suffer from this impact. So we need all to find solution to really tackle this new problem. And so I think this is more to call for more solidarity and try to find all together the solution for our planet. Next, please. And I would like to thank you very much for your attention, but also thank my colleagues who have been working very hard to prepare these slide sets. I hope you enjoyed the presentation, and happy to take some questions if we have time. Sarah, I am in your hand for the rest of the discussion. Thank you.
Thank you very much, Sylvie. It really actually struck me when you were speaking about the hope that everybody felt towards the end of last year, when there was so much positive news about the vaccines, and then entering into 2021 when the variants emerged, and it's, I think, been quite a difficult start to the year for many people everywhere. And that leads me to one of the first questions that's come in, and it's a question that's been repeated throughout 2020 and now into 2021. How long will this last, and when will it be over?
Yes, I understand that. I think first, probably in countries where we are heading towards spring and summer, it will be probably easier very soon because people can stay outside. And as you know, the transmission outside is much less than inside, especially in poor ventilated spaces. So I think it will be much easier to reduce transmission when we can resume our outside life. So I think this is a good thing. The other thing is that now a number of people have been already infected, so the population immunity is growing. Also, with the use of the vaccine that is protecting the most fragile individual in the society, the elderly and people with underlying condition, I think we will see very soon an impact of the vaccination, and so those people will be less likely to have a severe disease even if they are infected, and so less likely also to go to hospital and to overwhelm the healthcare services. So it will not be a change from, I mean, a dramatic change, but I think progressively we'll go to a situation that will be much easier to manage. And so it doesn't mean that the virus will be eliminated completely. We might still need to continue to wear masks in certain places, to wash our hands always, because it's always a good thing to wash your hands, not only for COVID-19, but for other diseases as well. So I think certain measures will need to continue for some time, but other measures will probably be suspended because the risk, I think, will be much lower. But there will be no zero risk for coming weeks, but at least a lesser risk that will enable us to resume progressively a life that is more social, probably. And so I think this is what we can say for the future, long-term future. I think we may end up in a situation slightly similar to what we know with influenza, with outbreaks, probably seasonal outbreaks, where again, fragile groups will be more at risk to have a severe disease and may need to be vaccinated or revaccinated, because we still don't know how long the immunity will last. But otherwise, it will not necessarily affect the population as we have seen during the first wave of this pandemic.
Thank you very much, Sylvie. We have a question coming in asking whether you can make some comments on how the pandemic has been addressed in humanitarian settings, such as Yemen.
Yeah. So in humanitarian settings, at the start of the pandemic, the difficulties were first that many public health and social measures were not easily implementable because of the population density. You cannot, people sometimes don't have a home, and so they cannot really stay at home. And also they may not have access to internet, and so for schools and other activities they cannot do it remotely. So the impact of public health and social measures in those settings were enormous. And in humanitarian setting, they really had to adapt those measures so that they can reduce the transmission, but at the same time make sure that people can survive. And they are living in very difficult conditions. So this was really the big challenge. And the international community worked a lot to make sure that they can at least access diagnostics at least access some treatments, even if it was not specific treatment, but at least some care to reduce mortality in those settings. And now we have also worked with the international community to make sure that they have access to what we call a humanitarian buffer of vaccine, so that even if vaccine doses are scarce, but they will get at least 5% of the COVAX stock for those settings. So as soon as we have enough vaccine, we will be able to vaccinate at least the most fragile people in those settings.
Thanks, Sylvie. And just a comment to those who are putting some questions in the chat. If you could redirect them to the Q&A, then we can address them. They get lost very quickly in the chat. Question from Nick. Some have speculated that more benign coronavirus infection might be caused by a virus which initially was as virulent as SARS-CoV. Could this perhaps happen with this virus in the future?
Can you repeat? I
didn't understand. Some have speculated that more benign infection might be caused by a virus that was initially as virulent as SARS-CoV. Could this perhaps happen with the virus in the future, that it becomes more benign over time, I think?
Okay, thanks. Well, at the beginning, it was a zoonotic virus. We think now that it's originated probably from bats, and then went to an intermediary host, and then to the human. So it's one of the 4 hypotheses that was investigated by the mission who went to Wuhan to work with the Chinese scientists to try to understand how this virus came into the human population. And so what we know about zoonotic viruses, because they originated in the animal world, that they are very far from the human body. And so they usually create more severe infections, because really they are not used to the human body. But in fact, as they circulate into human population, they tend to get adapted to the human population, and probably the human population also trying to get adapted to the virus. So after some time, indeed, usually they become, and this is what we have seen, probably more transmissible, but hopefully less virulent, because we are also able to protect better the high-risk individuals.
Thanks very much, Sylvie. And I know that you have to go to a meeting very shortly. I just want to say to everybody who submitted questions about the vaccine in particular, we are planning on next week's EPI-WIN webinar to be on the subject of vaccines. So I'm going to defer those questions and feed them into the planning for that webinar. But Carlos has come up with, actually, it's more a comment, really. Have we really learned anything after going through these pandemic phases? The impression is that each country has gone and continues to go its own way, considering the problem as if it were a problem isolated from that country. Wonder if you have any thoughts on that, Sylvie, before we bring this to a close.
I think I hope we'll learn something. And I think it's very important to learn from each event. I've been working in epidemics and pandemics. Each crisis is different. So, but what is important is learning from each crisis, trying to correct the course for the next one. We know that the next one we will certainly learn new things, but at least we know that we are making progress. And I think even if this pandemic has been very tough and very sad in many ways, there are many things that we have learned from it already, and we have already adapted and improved it. So, for example, the research, for instance, has been accelerated. And this was because we learned during the 2009 pandemic that doing research during emergency requires a number of mechanisms in place. And so before this pandemic, we had already developed some standard protocols that were shared immediately with the research community. This is why we have been able to have, in a record time, these solidarity trials that were done in many countries at the same time with the same protocol. And we have been able to yield results very rapidly and very strong evidence-based results. We have also learned from past experience that it's very important to publish scientific results very quickly. So that's why now we have platform to share preliminary data before the formal publications. We have learned a lot of things on the infodemic as well, how to manage the infodemic better, how to increase the social listening. And Sarah can talk about it, but we developed before this pandemic an EPI-WIN platform. And I think it has been very useful to increase the discussion with different communities of practice, the world of work, faith-based organizations. So I think every event we learn something. It's very important is to socialize those learning and making sure that at global level we can share those learning and making sure that the next generation will implement them, because the risk is also the loss of memory after some time, and that all the good learnings are lost because people do something else and are not always on board for the next crisis. So I hope that at least we can learn from that, and I know that there are many forums currently discussing the lessons learned, and I think it's great, and I hope a lot of publication will follow so that we as humanity we can learn from it.
Thank you so much, Sylvie. Thank you for being with us today, for sharing all your wisdom, your insights, and for speaking so clearly. There have been a lot of comments in the chat praising you for this. And so I'd like to just say thank you to everybody who's joined us today. We will look at the questions, and particularly the ones on the vaccines, feed those into next week's webinar. And we will share the slides with everybody who's registered, and the recording will be on YouTube. So thank you everybody for joining, and thank you Sylvie for your time, and I wish everybody a good rest of the day.
Yeah. Thank you very much. Bye bye everyone.
Goodbye everybody. And